I'm often asked how I entered this field of work. It was in the 1990s that I was approached by senior medical specialists at the Canberra Hospital to be involved in the study of chronic urogenital pain. Women attending the sexual health clinic at the hospital were struggling with symptoms of vulvar and bladder pain, which often manifested in burning, stabbing, painful intercourse, urinary frequency and urge, and many other related problems. Specialists were aware that these conditions were not responsive to psychological, medical or surgical treatments, and alternative interventions were needed. 25 years later, having seen several thousand women presenting with vulvodynia and bladder pain syndrome, Sherry and I are here to share with you our knowledge and experience.
Vulvodynia and bladder pain syndrome are common chronic pain disorders. Given that over 50% of women will suffer from some form of chronic pain during their lifetime, it is important to realise that more than 10% of women will present with chronic urogenital pain conditions, and that these are as common as back pain, asthma, or migraine headaches. We don't understand why, but the incidence of chronic urogenital pain continues to increase, yet it remains one of the most neglected areas of women's health.
One of the defining features of chronic pain is the absence of pathology that would explain the pain. Because of this, pain exists where there is no apparent reason for it to exist. All we can identify are symptoms reflecting functional changes in the reproductive and urinary systems associated with a complex interplay between peripheral and central mechanisms of pain.
Chronic urogenital pain conditions have a significant impact on women's quality of life and create feelings of distress, isolation, and loneliness. I have personally faced these challenges. I know the frustration of not having an accurate diagnosis and experiencing the disappointment of no effective treatment being available. I understand why many women choose to suffer in silence. But breaking this silence is our goal. We want to provide women with hope. We want to help women regain self-esteem, meaning, pleasure, and quality of life.
Through our clinical research work, we have sought to better understand the nature of chronic urogenital pain.
To this end, we have conducted the largest population profile studies that help us understand the women affected.
We have identified new anatomical areas associated with chronic urogenital pain.
We are working on identifying potential mechanisms of pain.
We have developed tools, protocols, and treatment methods that are constantly being evaluated and refined.
We share knowledge through international collaboration, workshops, conferencing, and publications.
We strive to be at the forefront of the work in chronic urogenital pain through ongoing multi-centre research and innovation.
Together, Marek and I bring 35 years of clinical experience, knowledge, skill, and compassion to this field. We want to help our fellow clinicians to better understand vulvodynia and bladder pain syndrome, and we are here to help manage these disorders more effectively and thus reduce the overall burden to the healthcare system and the individual.
Central to all that we do is the well-being of women who suffer from chronic urogenital pain. We are dedicated to connecting with them and meeting their needs, and we invite you to join us and do the same.